Welcome everyone to the National Fellow Online Lecture Series. The topic we will discuss today is braces, protective, and sports-specific equipment. My name is Dana. I'm a sports medicine physician at Dignity Health in California and your moderator for today. This lecture series is sponsored by the AMSSM Online Fellows Education Subcommittee and co-sponsored by the Education Committee and the Fellowship Committee. These lectures are meant to provide sports medicine fellows with direct access to learning from experienced AMSSM members and invited guest speakers to serve as an adjunct to individual fellowship program education and to assist in CAQ exam preparation. After the program, please complete the evaluation using the provided link. And now I'd like to introduce you to our expert speakers today, Dr. Anna Waterbrook and Dr. Dan Herman. Dr. Anna Waterbrook is board certified in emergency medicine and sports medicine and is a professor at the University of Arizona. She works as the team physician for the University of Arizona Intercollegiate Athletics and is also an associate program director for the UA Primary Care Sports Medicine Fellowship. She previously was associate program director of the South Campus Emergency Residency Program. Last year, she also served as co-chair of the AMSSM Education Committee. She has extensive experience in the acute management of injured athletes, both on and off the field. Dr. Dan Herman is board certified in PM&R and sports medicine and is the director of PM&R sports medicine research, as well as an associate professor at UC Davis. He has particular expertise in human movement biomechanics, and his research focuses on sports injury prevention and rehabilitation, particularly regarding the effect of concussion and baseline neurocognitive performance on neuromuscular control and musculoskeletal injury risk. Dr. Herman also studies the effect of headgear on athlete safety in girls lacrosse and other sports. For today's lecture, Dr. Waterbrook will cover MSK applications and Dr. Herman will cover head and eye protection. And with that, let's get started.
Hello, everyone. I'm Dr. Anna Waterbrook. I am from the University of Arizona in Tucson, Arizona, and I'm going to be speaking about sport-specific braces and protective equipment. I'm going to be focusing mostly on musculoskeletal applications of this equipment, and Dr. Dan Herman will be covering sport-specific head and eye protective equipment in a separately recorded lecture. I have no disclosures. Goals and objectives for this talk. Number one, to describe the basic principles and purposes of sport-specific bracing and protective equipment, and to recognize types and functions of sport-specific bracing and protective equipment. So really, the best method of managing and caring for athletic injuries is to prevent them from occurring in the first place. Certainly, many factors are important in the prevention of athletic injuries. When we consider sports protective equipment, we want to not only choose the correct type of equipment, but we also really need to ensure that the equipment chosen is appropriately designed and fitted for both primary and secondary injury prevention. Practicality is also super important because protective equipment ultimately needs to be worn by our athletes in order for it to be effective. Protective equipment should be simple to fit and maintain, be durable and reliable, not be extremely expensive, and provide minimal functional interference for the athlete. We have to remember that protective equipment can actually also be abused by our players as well as their opponents. The equipment may be used as a weapon against the player's opponent, or the opponent may see this as a vulnerability in the athlete and use it to the opponent's advantage against the player. Our athletes may end up relying too heavily on the equipment to protect them and take dangerous risks that they may not otherwise take. While there certainly are general principles to consider when choosing sport-specific equipment and braces, we also need to consider that protection is sport-specific. Types of protection needed will vary based upon different types of sports and different types of position. So, for example, in collision and contact sports, we need to be able to protect exposed and vulnerable areas from impact with either the surface or other players. Vital areas such as the head, the neck, kidneys, and genitalia all need to be protected. We also need to consider high velocity hazards that can be seen in sports that use projectiles such as balls or pucks. We also want to consider dental protection such as mouth guards to prevent dental injuries. Padding is a really commonly used protective equipment in sports, and this is really used to protect primary contact points. Common sports that utilize padding include football, hockey, and lacrosse. In football, all football padding has a hard plastic cover over a foam padding to improve protection against a direct blow. On the left here, you can see a cantilevered shoulder pad used in football. Basically, this provides a larger surface area and disperses impact forces over a larger area via its cantilever or convex strap. And so you get more protection to the wearer's upper shoulder, chest, and back. It's commonly used by linemen who block and tackle. This other shoulder padding used by football players are flat and less obstructive for shoulder range of motion and are commonly used by skills players, such as quarterbacks and wide receivers. Hockey players oftentimes use a lighter shoulder padding than football players to allow more freedom of movement. They don't have the hard plastic covering over the padding. However, it still is protective against the shoulders, chest, and upper back. Lacrosse players use shoulder padding similar to hockey players. Chest protectors are used in sports where impact to the chest can occur, such as in baseball, softball, and field hockey. And then we have elbow pads, wrist guards, and knee pads. And these are all used to protect against direct trauma and injury to the areas. Gloves are another type of commonly used sport-specific equipment, and these are used in sports such as football, hockey, lacrosse, and boxing. Gloves are often used by wide receivers in football to improve their grip on the football itself. They're also used by players to keep their hands warm in inclement climates. In hockey, as well as in lacrosse, gloves are used to protect the hand and wrist from direct blows. In hockey, the goalkeeper's gloves are quite a bit larger than other players. On the stick hand, the glove has a large deflector pad that you can see here. And on the opposite hand, the glove is actually similar to a baseball glove to facilitate catching of the puck. And then finally, in boxing, gloves are certainly used to protect the fighter's hand and wrist, but also to protect the opponent's head from trauma. In softball and baseball, breakaway bases are commonly used as they've been shown to reduce the incidence of sliding-related injuries that are seen in these sports. Their use has actually been recommended by an AAOS position statement that was published in September of 2015. The way that these breakaway bases work is that there are suction cups which adhere the base to the base plate, as can be seen in this picture. And essentially what happens is that the base dissociates from the base plate if enough force is applied, such as in sliding. Bracing plays a huge role in sports, and there's lots of different braces that are used. And there's certainly overlap in terms of why they are used, both in terms of prevention of injury as well as in treatment of both acute as well as chronic injuries. Few key principles to keep in mind when we're considering bracing in our athletes. We have to remember that fit is going to be very important. We need to make sure that the braces fit well and that the athlete is comfortable in the brace before we send them out of clinic. We also want to make sure that the athlete knows how to properly put on the brace so that they don't actually accidentally put it on backwards. Not only will it not work as well as it was designed to work, it also may put the athlete at increased risk of sustaining other injuries if it is not used correctly. So when should we consider using braces? 1, if we want to improve disease progression. 2, we may want to immobilize an unstable joint. 3, we may want to unload a joint. We may want to eliminate range of motion in one or more directions. And we may need to diminish pain. We also need to ensure that we have an accurate diagnosis when we are using braces. If we use the wrong brace, as I mentioned earlier, this could lead to significant injury. And of course, we want to take a patient-centered approach. We really need to discuss with the athlete what their expectations are with using the brace, as well as their expectations for recovery, any concerns that they may have, as well as understanding the nature of the activity that they're going to be able to participate in while using the brace. So braces that we are going to cover throughout the rest of this talk, we're going to discuss knee braces, ankle braces, shoulder braces, as well as some wrist braces. Knee braces can be considered for use both for prophylactic indications as well as to treat injuries. Injury treatment can consist of rehabilitative uses of braces, and these are usually used to control motion following an injury. Functionally, to support unstable knees, such as in an anterior cruciate ligament tear, as well as to support the patellofemoral joint, and can be utilized for patellofemoral pain syndrome, patellar tendinopathy, as well as patellar instability. Different types of knee braces that are commonly used in our athletes include the basic neoprene compression sleeve, a hinged knee brace, a locking hinged knee brace or a T-scope, and a patellar stabilizing brace. Knee injuries that we commonly use braces for include medial collateral ligament injuries, lateral collateral ligament injuries, anterior cruciate ligament injuries, as well as in patellar instability. Medial collateral ligament tears are a common knee injury in which we utilize bracing in our athletes. And we can utilize braces in grades 1, 2, and 3 injuries. The main focus of utilizing these braces is to prevent any further valgus force applied to the knee that could exacerbate the underlying injury and therefore delay healing. We may also want to consider using hinged knee braces prophylactically to prevent against MCL tears. While there really isn't definitive evidence that these braces decrease knee injuries, there are some studies that have shown a significant trend towards decreasing MCL injuries, especially in American football linemen, and explains the almost ubiquitous use of these hinged knee braces amongst these players. Lateral collateral ligament tears are also another common knee injury in which bracing is indicated, especially in grade 1 and 2 lateral collateral ligament tears. In general, you want to provide these athletes with a short period of immobilization and crutches as needed for pain control. And then you can progress their weight bearing with protected flexion in a locking hinged knee brace over the first couple of weeks. When our athletes have sustained a grade 3 lateral collateral ligament tear, we need to be careful because these are oftentimes associated with concomitant injuries, such as injuries to the posterior lateral corner, and oftentimes need surgical management for definitive care. Anterior cruciate ligament tears are also commonly managed with knee bracing. Indications are usually after an acute injury if the athlete has significant knee instability, as well as in the immediate postoperative period. Despite many studies looking at uses for knee bracing to prevent ACL tears, there really is no evidence that supports using any form of currently available knee braces to prevent ACL tears. And then finally, we want to look at knee bracing for lateral patellar dislocations. We can use a buttress support brace as well as a PTO brace. In general, lateral patellar dislocations are initially managed usually with a short course of knee immobilization, and then we transition them into one of these knee braces to stabilize the lateral patella. These braces are actually very well tolerated by the athletes and allows them to rehabilitate their knee and return to sports. Now I want to move on to discussing ankle injuries and use of bracing for ankle injuries. Commonly used braces for ankle injuries in our athletes include lace-up ankle braces with straps, stirrup braces, as well as stirrup braces with hinges. The lace-up ankle brace are usually functional and typically made of a sturdy fabric such as muslin or leather. The lace-up ankle braces with straps are basically the functional lace-up brace with an added figure of 8 straps, which provides better ankle stability. The stirrup braces contain hard plastic sides with foam or air-filled pads to stabilize the ankle and are good for immediate post-injury protection. And then the stirrup with hinges also have the functional hard plastic sides with foam or padding, but also contain hinges at the ankle joint to provide some added mobility to the ankle. Ankle injuries in athletes most commonly are going to be ankle sprains, as these make up the most common injury in sports. 95% of these are lateral and 5% are medial. Luckily, conservative management is what is needed for most of these. So different equipment and bracing that can be used in management of ankle sprains include using this U-shaped foam padding in order to facilitate getting rid of any ankle edema and thereby reducing the athlete's ankle pain. In more severe ankle sprains, or if the athlete is unable to weight bear, you may want to provide them with a cam walking boot for a short period of immobilization. However, you want to transition them out of this as quickly as possible in order to be able to better rehabilitate the ankle. Other braces that can be used in lieu of the cam walking boot include the stirrup ankle brace, as well as the lace-up figure of 8 brace. In terms of prophylactic ankle bracing, there's actually pretty strong evidence that it reduces secondary ankle sprains after the initial injury, so use in secondary prevention. And there's also good evidence for use in chronic ankle instability in our athletes. There have been some studies that have looked at the utility of taping versus using functional ankle bracing. And while there are some studies that show a trend towards more stability with functional bracing over taping, the evidence is certainly not conclusive. And generally, taping is seen as very similar or equivalent to using functional bracing. Certainly, that's going to depend on your athlete as well as the nature of their sport. In addition, while there's no conclusive evidence, there are some newer studies that show benefit in ankle bracing for primary prevention of ankle sprains. There's been some newer studies in high school volleyball, basketball, and football players, which have shown prevention of primary ankle sprains. And so you may want to consider using ankle bracing not just for secondary prevention and in chronic ankle instability, but also for primary prevention of ankle sprains. Next, I want to briefly talk about bracing for shoulder injuries. Some common bracing that is used is the AC joint injury pad and AC separation. There are a couple different models of these, and these essentially protect the AC joint from further injury during sport. And then there are a couple of different braces used for shoulder instability, and these are particularly useful when the athlete sustains an injury in season and they want to wait for definitive surgical management until the end of the season. The Sully brace up top is a commonly used brace for this, and it's a neoprene brace with elastic straps that wrap around the athlete's torso and the affected shoulder. Because of both the elastic straps and the neoprene material of the sleeve, it provides a relative restriction to motion of the shoulder in abduction and external rotation. Although the elastic nature of the brace really does not provide the rigid restrictions that you see in this other brace type, it does allow for greater range of motion and is particularly useful in athletes who need overhead movement of their shoulder. This more rigid brace that's shown below certainly provides more rigid restriction to abduction and external rotation and is very similar to the Sully brace in the way that it wraps around the torso and the affected shoulder of the athlete. However, it's as I mentioned, it is more restrictive and actually provides a hard stop to external rotation and abduction. So while it certainly gives the athlete more stability, it lacks the range of motion that's afforded by the Sully brace. So these can be used in athletes that don't require the extremes of motion for their sport, such as in football linemen. And then finally, there are several braces that can be used for wrist injuries and wrist injury prevention. In the middle, this is a neutral wrist splint that has plastic or metal stays to protect the wrist from hyperextension and hyperflexion injuries. Can also be used to treat sprains and strains of the wrist and hand. On the right here, this is a soft thumb brace that can also be used for minor sprains and strains. And then on the upper left here, you can see the thumb spica brace, which can be used in treatment of scaphoid fractures and to provide more stability to the wrist. So in conclusion, it's really important that you know the different types of sport-specific equipment and bracing out there, as well as the indications for utilizing them. You want to know what you're using them for and whether you're trying to prevent an injury from occurring or whether you're treating an acute or chronic injury. And remember that fit and comfort are going to be very important in treating your athlete, as well as educating them on the proper use of the brace. Because as I mentioned before, no brace, no matter how well made it is going to be effective in an athlete that either doesn't use it or doesn't use it appropriately. Thank you so much for your time and attention.
Hi, my name is Dan Herman, and I'm an associate professor in the Department of Physical Medicine and Rehabilitation at the University of California at Davis. I'm going to be taking part 2 of the presentation today on braces, protective, and sports-specific equipment, and speak specifically with relevance to sports neurotrauma. I have nothing to disclose. All these, I think, mean nothing or none. Perhaps a little bit of question on that last one. I think it means none. Might mean something else, kind of like the tattoo I got in college. Joking. In terms of an outline for my presentation, I'm going to be focusing most of my time on helmets, as one might expect, but we'll also be discussing eye protection, mouth guards, neck collars, and a little bit on emerging technology. So I'm first going to take a little bit of time to talk about the history of helmets and how they came about. This is particularly in the context of American football. In the early 1900s, American football was actually quite rough, and approximately 86 deaths were recorded in college football over a 9-year period. You can see this cartoon, which was run in one of the papers from Cincinnati, depicting the Grim Reaper sitting up on the goalposts, surveying all the carnage that was wrought by American football. A lot of these deaths occurred from skull fractures and associated intracerebral hemorrhage, although there were some injuries that were neck fractures and deaths due to internal organ damage. So a debate broke out regarding how do we reduce the rate of these injuries, and particularly what rules can we institute to make the game safer. And this actually was largely a Harvard versus Yale discussion, pitting Walter Camp from Yale against Coach Reed from Harvard. Coach Camp was actually more of a traditionalist, and Coach Reed was more of an innovator and wanted to make rule changes, such as offensive defensive line and the forward pass that would be attempts to make the game safer. Despite all this, it's interesting to note that Walter Camp is regarded as the father of modern football. These talks were brokered by the president at the time, Teddy Roosevelt, who gets a lot of credit in historicals, calling him the savior of football. However, in the context of headgear, probably gets an overdue amount of credit, as helmets were introduced much later, decades later, with the NCAA in 39 and the NFL mandate occurred in 43. This background information does give us some context, however, with regards to the purpose of helmets in most sports. And in most sports, the primary purpose of helmets is to prevent skull fracture. It's not to prevent concussion. It's to prevent more serious life-threatening injuries and disabling injuries. So how do these helmets stack up with regards to this primary purpose? Well, if we look at cycling and snow sports, this is where the data is the most robust, and they demonstrate that these helmets can result in a significant reduction in serious head injuries. If we look at team sports such as ice hockey and American football, studies show that there these helmets are associated with a significant reduction in serious head injuries. The studies are not quite as robust and are associated primarily with looking at injury rates before and after certain mandates and standards took place. But the data do point to a reduction in serious head injuries. So overall, the bottom line is that helmets reduce serious head injury. But of course, that leaves the question, what about concussions? And as many of you know, that is a very controversial topic. A lot of people will point out that helmets usually do a pretty good job of attenuating linear blows to the head, but don't do a very good job of attenuating rotational blows. And in many sports, rotational blows are actually the more common mechanism of injury for concussion. However, in some sports, linear blows are actually a more common mechanism, and so it may make sense to use helmets or headgear in such sports. Additionally, there is the concern regarding something called the Peltzman effect. Dr. Waterbrook touched upon this point in her presentation earlier. Peltzman was an economist who studied how people took outsized financial risks relative to the safeguards that were in place. And then this notion has been applied to the potential for behavioral changes in the context of safety equipment, ranging from occupational settings to vehicles and ultimately to sports as well. In sports, this is also known as the gladiator effect, the theory of which is that athletes with more protective equipment will engage in more risky behaviors, and opponents will also be more belligerent towards players with more equipment, thus paradoxically potentially increasing injury risk. However, despite the amount of ink that's been spilled on this topic and the amount of hand-wringing that has been had, currently there's not a whole lot of evidence demonstrating this behavior or demonstrating that there are paradoxical increases in injury risk with protective equipment use. So now I'm going to talk about some specific sports, and we're going to jump right in with the big kahuna of American football. A common refrain that you hear is that helmets don't prevent concussions. And that's true as far as it goes, but that's also a pretty maximalist take, very much an all or nothing statement. And although there's some studies that have failed to find an association, the current available literature does include some evidence supporting a relative reduction in concussions among more recent models of helmets. This is supported in part by laboratory-based measures. Researchers at Virginia Tech developed the STAR system to evaluate the ability of helmets to attenuate impacts in a laboratory setting. And as you can see on this chart, more recent helmet designs tend to score better than older models. And features in more recent models range from structural crumple zones designed to attenuate force, whether in the lining of the helmet as seen here, which may offer some force attenuation to both linear and rotational blows, as well as the inclusion of flex panels on the outer shell at commonly struck locations. Other innovations include externally applied padding for use during practices. The NFL actually used these during the preseason this year, and despite some concerns from some corners regarding behaviors that may have been altered during the use of this device, again, going back to that concept of gladiator effect, the NFL did report a significant reduction in concussions during that preseason period, although this was not peer-reviewed data. And finally, there is some evidence associating poor helmet fit with worse concussion symptoms, although nothing with regards to changes in concussion incidence. Other sports, such as cycling and snow sports, have mixed evidence demonstrating that helmets reduce the risk of concussion. Many of the studies in these sports are based on emergency room presentations, and so they lack data on the number of athletes that are using headgear in the community, as well as the duration of exposure. So not necessarily good studies overall. In other team sports, hockey has some data showing an association of poor fit of the helmet with concussion risk, but no overall strong evidence supporting the use of helmets to reduce concussion. Moving on to the sports of rugby and Australian rules football, you'll note that I struck out the word helmet and actually have changed to the word headgear. And that's because the headgear worn in these sports is actually a soft headgear. It lacks a hard outer shell. You'll also note that this is probably going to be the best photo that I'm using in this presentation, bar none. You can disagree with me, but just know that you're wrong. Anyway, studies have looked at the risk of concussion in athletes who are using headgear versus not using headgear and have shown really no effect, no reduction in concussion risk. However, it's important to note that these headgear have not really been designed or are expected to protect against any form of mild traumatic brain injury. Soft headgear has also been studied in the sport of soccer, most recently a randomized control trial in 2020 published in BJSM. The researchers there looked at the effect of primarily 3 different headgear. And they determined that soccer headgear did not reduce the incidence or severity of sports-related concussion in high school soccer players. However, it's important to note that these headgear actually had very different star impact ratings, with the ultra force field there on the left being a 2-star, the full 90 being a 3-star, and the Storelli model being a 5-star. Incidentally, if you look at the crosstabs of the data, the force field tended to perform the worst among these, with the Storelli performing the best. The force field actually was associated with an increased risk of concussion among male soccer players, and the Storelli was associated with a decrease in concussion risk among the female players. So I do feel that this statement that soccer headgear did not reduce the incidence of sports-related concussion deserves an asterisk. I think there's a larger story that is to be told, and studies should be continued. But for now, the official line is that soccer headgear does not reduce concussion risk. And now on to women's lacrosse. Women's lacrosse is actually a non-contact sport, but features a relatively high rate of concussion. This has prompted a debate within the sport regarding the potential use of headgear to reduce the risk of concussion. The state of Florida actually mandated the use of headgear in 2018. And so we took this opportunity to study this effect and study the rate of concussion within the state of Florida compared to other states in the union which do not mandate headgear. My study group actually found that in those states that did not use headgear, or did not mandate the use of headgear, had a much higher rate of concussions, approximately 60% higher overall, and approximately 75% when you look at only games. This is supported by a smaller study that was performed in New York public schools. And so overall, there is evidence supporting a reduced concussion risk with headgear use in this sport. Incidentally, it's important to note that the mechanism of injury for most concussions in lacrosse is via being struck by a ball or struck by a stick. Those blows tend to be more linear in nature rather than rotational. And so that may result in headgear being more effective in this sport relative to other sports that may feature more rotational blows. Moving off the topic of helmets and headgear and on to eye protection. If an athlete requires visual correction, it is recommended that they use shatterproof polycarbonate eye protection with a standardized frame in order to reduce the risk of ocular injuries in higher risk sports. This is particularly the case for the functionally monocular athlete, who should be required to use such protection in higher risk sports and who should be restricted from play with regards to combat and intentional harm sports during which such protection cannot be used. It is important to heed these standards with respect to eye protection, as normal, non-standard, or street eyewear, such as glasses, sunglasses, and contacts, may actually worsen an injury should it occur. So if an athlete is using contacts, they should wear standardized non-corrective eye protection. Higher risk sports include contact sports, sports with rackets or bats, and sports featuring high velocity balls or projectiles, particularly if occurring within a confined space. Such examples include racquetball and squash, as well as softball and baseball. While it's recommended in these sports, uptake rates of eye protection is actually relatively low. Additionally, there's little data regarding the efficacy of eye protection in these sports. You'll often hear people issue a blanket statement that 90% of ocular injuries can be prevented with the use of eye protection, but personally have not been able to determine the provenance of that exact number. However, there are some sports for which there's relatively strong data regarding eye protection and the risk of ocular injuries. Mandated protective eyewear has been associated with a decrease in ocular trauma in both women's lacrosse and in field hockey. It's interesting to note that despite these findings, the National Federation of High School State Associations actually ended the national mandate on eyewear for high school field hockey athletes in 2020, citing concerns regarding the athlete's ability to wear corrective vision corrections such as glasses and contacts. However, many in the sport actually welcome this change due to perceptions regarding more aggressive play with the use of the goggles. Again, going back to this idea of a potential gladiator effect. However, despite these concerns, these mandates have not been associated with an increase in other non-ocular injuries. Similarly, in ice hockey, both partial and full face shields have been shown to reduce the risk of ocular trauma and are not associated with a risk of other injuries. The current data in the literature suggests that a full face shield offers superior protection against ocular injuries. Not only can a hockey stick blade slide up underneath a partial face shield, but a full shield also requires closer integration and fit with the head and face, whereas helmets with a partial shield are often worn much looser and may slip back on the head, thus exposing the eyes to potential injury. There's also some evidence to suggest that a closer fit offered by a full face mask may attenuate the severity of concussion. And I go back to prior mentions about fit of helmets and the risk of concussion or the severity of concussion in previous slides. And now on to mouth guards. Mouth guards have been shown in multiple studies to reduce the risk of oral facial trauma. However, this is a talk on sports neurotrauma. So what about concussions? Well, our current body of literature doesn't really support a link between mouthguard use and a reduction in concussion risk. There are some studies out there that suggest point estimates that indicate a trend towards reduction in concussion risk, and some studies that show no effect, and some studies that actually suggest a point estimate in the opposite direction. These studies are pretty much the same, no matter if you're looking at off-the-shelf boil and bite type mouth guards versus custom mouth guards. So while mouth guards are really good at preventing dental trauma, there's really no consistent evidence suggesting that they reduce the risk of concussion. Now moving off of concussion entirely and onto the topic of neck collars for the purpose of preventing brachial plexus injuries or stingers in American football. So there's actually not really any epidemiologic data regarding this particular piece of equipment. However, there is some lab-based data to demonstrate that various types of collars can reduce the amount of cervical extension when you're given an external blow. This is shown here in this video where a hybrid headform model fitted with a helmet and pads and then a collar on the left and then no collar on the right is struck with an external force. And you can see that the model on the left with the collar has significantly reduced amount of cervical extension after the blow. However, cervical extension is not really the main mechanism by which we're concerned for stingers. That's more with side bending or lateral cervical flexion. And in lab studies, only one collar has been shown to reduce the amount of lateral bending, and that's the Kerr collar. Again, in this video, you can see the externally applied force to the model and a reduced amount of lateral side bending on the left in the model that's using the Kerr collar. So again, no epidemiologic data, but there is some lab-based data supporting their use. I'll say that just from a clinical experience level, these Kerr collars tend to work very well in my athletes who have problems with stingers. And now a few notes on some emerging technology. This is by no means comprehensive, but I wanted to note a few things that might be coming around the corner. And the first thing I wanted to mention was internal jugular venous compression. These are devices worn around the neck. They're meant to place some compression on the jugular vein to help increase the amount of turgor within the brain and reduce the amount of quote unquote slosh, or the amount that the brain moves within the cranial cavity when an external force is applied. And there are studies that demonstrate that athletes who have been using this collar tend to have better white matter integrity on diffusion tensor imaging, better functional MRI findings, and better cognition on certain tests in comparison to athletes who have not been using the collar. However, I will note that most of these studies are actually conflicted and involve funding from the company that actually makes this device and the individuals who are consulting or otherwise involved with the company. Data regarding whether or not this actually results in a reduction in concussion risk are pending. There's also a device that is essentially a replacement for bicycle helmets that uses an airbag approach. So I use this helmet in quote. It is a device that sits around the neck, and once you're about to lose it, it senses that you're flying off your bicycle and about to hit the ground. It deploys and puts an airbag around the head and reduces the amount of force applied to the head when hitting the ground. Now, there's no epidemiologic data on this, but there are some laboratory-based measures that suggest that overall force transmission to the head might be reduced sixfold compared to traditional helmets. These are actually on the market in Europe, but are waiting approval for use in the United States. And then finally, there are companies that are trying to do 3D printed helmet liners that are essentially a bespoke helmet liner. They take various measurements of the entire head and then do a 3D printed liner that's specifically for that athlete. Again, I go back to some of the studies, as I previously mentioned, that have looked at fit and severity of concussion or risk of concussion. And so this is meant to improve the fit between and the interface between the athlete and the liner and ultimately the helmet. Additionally, the lattice work that's used in this 3D printing is supposed to improve the amount of directionality of force attenuation, thereby not only potentially limiting the amount of force transmission of linear blows, but also potentially of rotational blows. So bringing it all together in summary, helmets reduce the risk of serious head injury. However, the data regarding concussion and use of helmets or headgear is currently mixed and is likely headgear and sports specific. Eye protection reduces the risk of ocular trauma without increasing the risk of other injuries. Mouth guards do not reduce the risk of concussion. They're good at reducing the risk of oral facial trauma, but are not associated with a decrease in concussion risk. And finally, laboratory findings support the use of the Kerr collar to reduce the risk of stingers. However, there's not really any epidemiologic data to support their use. Thank you for watching. I hope you've enjoyed this presentation. Again, my name is Dan Herman, and if you have any questions or comments, feel free to email me at the email listed on this slide. If you didn't like this presentation, my name is Jason Zaremski, and you can instead email me here at this email address. Of course, I'm just joking. Got to poke a little bit of fun at a friend. Thank you.
Thank you again, Dr. Waterbrook and Dr. Herman, for taking the time to speak with us today. And thank you everyone for your attention. If you haven't already, please take a minute to fill out the linked feedback form. Have a good night, everyone.